Hey team, Dr. Josh Wagner here. In this video, I'm going to give you 3 must-haves for far more care continuation and patients getting on to what some of you may call wellness, continuing with care. I'm Dr. Josh Wagner with Patient Mastery, where we help awesome chiropractors become the go-to doctor in town with financial freedom and absolutely loving practice with more time off. So let's get into this conversation. You may call it care continuation, you may call it wellness, maintenance, protection, prevention. I've heard all of those terms. They're all pretty much awful and actually sabotaging you from getting more. So you're gonna wanna take notes because there's 3 main factors. The first one is you've most likely been taught from our profession, from the gurus, from the leaders, really incorrectly that wellness patients or lifetime patients should start from the very first visit they have with you and be a lifetime visit forever. And if that's not happening, you're failing as a chiropractor, you're not educating enough, you're not doing the right job, and it causes really great chiropractors to get down on themselves, lose their deserving belief, and feel like you're banging your head against a wall throughout your career when that's actually not the natural lifeline of a patient or lifespan of a patient. So the first off, most likely, you have initial recommendations. You're probably not telling your new patients from their first consult and recommendations that they're gonna come see you for the rest of their life without stopping once a week. You're probably not doing that because it's no different than on a first date telling the person you wanna marry them. It just comes off a little weird, even if you do. So here's the first place chiros go wrong. You come to the end of your initial plan and the person either feels great, is all resolved, or maybe they're 60, 70, 80, 90% of the way there, and they're choosing to stop. They're choosing to not continue or schedule another appointment, and the person feels from you, even though you're not saying this, energetically, they feel like they're doing it wrong. They're feeling like they failed you. They're feeling like a bad patient because they're not choosing one of the wellness or maintenance plans that you're suggesting to them. If a patient ever feels that, if there's anything less than an absolute gracious goodbye and we are absolutely here whenever you need us and we're gonna stay in contact and we love you so much and a high five for the results you got, if there's anything less than that, you're most likely losing that person from coming back or referring even when they don't have an active patient appointment on the books. And think about over the 5, 10, 20, 30 years you've been in practice, how many patients you've seen that still live in your town, aren't dead, and aren't coming back and aren't referring to you, and most likely have had plenty of other conditions you can help, and they know you can help, but they've either gone to a different modality, maybe an acupuncturist, maybe a PT, maybe injection, or they've gone to another chiropractor because they've been felt, they've been made to feel wrong for not being a good patient and continuing forever with your next options. This is a really genuine, sincere concern, and you're losing them from coming back and you're losing them from referring. A normal patient who loves you is going to refer to you even if they don't have an active appointment on the books. And most people, the real lifeline, lifespan of a wellness patient is they come to you for a condition. They get that resolved or resolved enough for their liking, they stop. They come back to you at a later time for a different condition, or maybe it re-exacerbated. They stop. They come back to you, and at a certain point, over a certain number of back and forth, they either continue on, you know what, it makes sense for me to come on a more regular basis, even if I feel fine, or it's absolutely fine to have a patient who comes back for spurts based on different conditions throughout life because life is stressful and we're always going to be dealing with health concerns and stress on the body and pains and all the stuff that drives patients into your practice. So the first one is, if you're making people wrong, you are cutting off reactivations, continuation, and referrals. And it's a big sabotage in our profession because so many chiropractors are made to be wrong by their coach, by their guru, by the person on stage who's not doing it, and then you end up doing that to your patients when the majority of new patients are not going to continue with you for life. That's just not how people operate. So that's the first one. Be careful, don't make people wrong. Know that they're always welcome back. And do you have systems in place that your team runs to constantly be staying in communication with them? Emails, especially, because it's practically free and it's really easy. It's not like you're having your CA make 100 calls every day. That's the first one. Second, a big sabotaging mistake that our profession teaches chiropractors is thinking to start with the end goal, meaning someone comes into you because they have a condition. Even if you have a health and wellness center, that's how you promote it, that's what your website says, 99% of your patients are coming in with, I've got this problem and I want it fixed. They're not coming in with, I'm looking for my new wellness chiropractor. Let's just be honest. It doesn't matter how amazing you are, it doesn't matter if that's your intention, 99% of patients, new patients, are coming in with, I've got a problem and I want it to be fixed so life can get better. As a chiropractor, we're taught, well, our goal is clearly to help them with that and then keep them on care forever. So we need to plant that seed and start with that from the beginning, from the website to the first phone call when they call in, is this for you or your entire family? Is this for, whatever, you know what I'm talking about, like really stupid phone scripts. Or starting to talk about that during the consult, or starting to talk about it during the recommendations, or recommending care that spans both initial to get them back to where they want to be, plus maintenance, plus wellness, and then we create this like year-long care plan, and the patient only cared about that first amount of time, which is going to get them back to where they want to be. Now, I know you're taught to justify it with physiology and anatomy and charts, and like if they just get to here and then they stop, it's going to go back, and all this mumbo-jumbo timeshare stuff, but patients see right through that. And if you start them on a relationship of the goal is, this is where we're going to get to, where you're coming once a week or once a month forever, it immediately sabotages their relationship because the patient comes in with stressed mentally, not just physically, with wanting something, and the doctor is saying, okay, yeah, we'll fix that, and we're going to do something totally different as well. And that's one of the biggest issues our profession has, why we see so few people and why so many chiropractors struggle with getting paid, getting referrals, and getting retention, is because we want something different than the customer wants. And what business works well with that model? Chiropractic has survived because what we do works so well, but our operating system and how we're taught to do it is an absolute mess and an absolute nightmare. That's why patient mastery, collections go up, time in the practice goes down, and it's so much easier. So, are you starting from the beginning talking about wellness, or even before that patient starts getting results? Because before the patient starts getting results, they don't have trust that what you say works. They may trust you enough to pay you and start the process, but until you're getting results, it's still, the jury's out. So if you start talking about the next phase before you've even gotten the results on the first phase, good luck. Kind of like in patient mastery, like, hey, if we allow you into patient mastery, we give you 30 days to check out the material and start seeing results. If it's not a fit, there's no commitment. You don't stay in. Complete, like, you got to trust us, you got to see it's working. No bait and switch, no fear tactics, nothing like that. Like, complete authenticity, and like, what we do works. If you don't want to work it, don't stay in, but we're going to give you an option to experience that. So same with a patient. If you start talking about the next phases while they haven't even gotten the first one resolved, one, they're still in stressed mindset because they're still having that back pain, neck pain. They can't hear the logical understanding of why maintenance and prevention and wellness will be beneficial a year down the road, 3 years, will save them money. They can't hear that. So if you start talking about it too early, the same thing happens. This doctor wants something different than what I want. And how quickly can I get out of here? Because this relationship doesn't feel good. You can start educating on the benefits of whatever you call it, wellness, maintenance, protection, prevention, once that patient is able to hear it. And they can't hear it when they're still focused on their initial concern. So another timing, be careful when you introduce it, there's a time and a place to introduce education for continuation, and it's never in the beginning. That's point 2. Point 3, are you trying to sell the invisible? The invisible is wellness. It's something that is, wellness kind of like prevention. Prevention is something won't happen. That's invisible. Wellness is invisible. Maintenance is invisible, meaning they're not actually getting something that's going to move them forward. It's kind of like insurance, which most people don't want to have a talk with an insurance salesman. It's you're going to pay so something doesn't happen. You're going to pay so something bad doesn't happen. That's what maintenance is. So it's a frustrating concept, and it's also, most people feel it's, well, I paid to get the results. Now you're saying I have to pay to keep them? Kind of feels like a bait and switch. So that's why maintenance is a really bad term. Wellness, prevention, and protection is just like selling life insurance. I'm not saying life insurance is wrong. Certain people have certain reasons they want it and for certain reasons, but so much of it is about protecting against something bad happening. Rather than, so be careful if you're using those terms, you're planting seeds of people are being asked to pay for the invisible. And again, you're gonna have that 5% be interested in that, the 1 out of 20. So I want you to think, this is the bonus number 4, and we teach you the formulas, we teach you the conversations, the paperwork, everything for you and your team. So it's so easy, so congruent. Number 4 is, when someone is getting to the end of that initial care, and let's say they feel 100%, they're 100% resolved, or maybe they're 80 or 90, are you finding out multiple things? Like 1, what's next that they can benefit from chiropractic care, rather than just avoid, like, okay, keep paying and keep so something doesn't come back? That's not a valuable proposition. But what can they actually get? They told you initially what they wanted and the difference it's going to make in their life. Okay, maybe they've gotten to that, maybe they've gotten 60, 70, 80, 90%. Now they're in a different place of not just getting back to normal, but now that I realize how this is making me function and better, what else do I want? Like, maybe I'm going to start sharing with him about what I do on the weekends and all the physical activity, and that can be better. The marathons, the picking up the grandchildren. After I've got out of crisis mode, now it's like next goal setting mode. Because whether it's a patient with a health concern or you in your practice, everyone's got a goal. Everyone's got a next want. And as soon as you get to it, whether you in your practice, maybe it's a collections level, guess what? You're not going to be content staying there for the rest. You're going to say, I want something better, either more, less time, easier. That's humans. The same with health. People get back to, let's say, normal. They get back to their life. That's the initial phase. There's always I want it to get better. And when you know how to ask the right questions, navigate the relationship, so you're finding out what that is, that's what has patients pay happily to continue on, rather than pay reluctantly to avoid losing what they've gotten. See the difference between the profession's dogma and ridiculousness, wellness, maintenance, protection, prevention? I'm sure there's other ones. No one wants to pay for that in our society, but people want to pay for what they want. And rather than giving people a cookie cutter canned message, find out what it is they want next. And do you believe that continued care with whatever you provide, every chiropractor is different, can help lead them toward that? And then it's very similar to the initial new patient conversation, but shorter and simpler, because you already have this connection and rapport from them, and they already trust you because they've gotten a certain amount of results. So let's stop there. Comment below, did you watch this live? Did you watch this recorded? What made the biggest difference out of those 3 points of what not to do and what sabotages care continuation? And then the bonus 4th of where your mind needs to go to in your process with your patients need to go to in order to have a lot more care continuation, which, think about it, the more people who are continuing, the less new patients you need to maintain or even grow in collections, which just makes it a lot easier in practice. All right, you guys rock. I gotta jump. You need anything, comment below, and stay great, keep being great, and look for these weekly videos and messages coming through right to you.